Depression affects millions of Americans year-round and can be especially challenging at the holidays. And for some people, traditional treatments simply don't help. Today, I'm joined by Dr. Haviva Malina. She's here to talk about her work treating depression with ketamine. Welcome to the show, Dr. Malina.
Thank you for having me.
I love this conversation because I think it's going to be really eye-opening for a lot of folks, myself included. When I think about ketamine, I don't know enough about it. To me, I associate it with, it's like a party drug. But I've heard it's also used for depression. So I wonder if you could tell us what the average person should know about ketamine.
Yes. So ketamine is actually a very old medicine. It's been around for decades, and it's been used in other medical contexts. So it's been used for anesthesia in higher doses. And to this day, it's used in the emergency room, in the operating room for sedation. But in the last decade or so, it's been shown to be very helpful for depression, anxiety, and PTSD. It's been shown to be extremely helpful to move the needle with people's symptoms in a way that traditional medications just don't. And it comes in multiple forms.
Sure.
There's the intravenous form.
Before we get into that,
Sure.
What are some of the numbers around depression?
Yes.
And why, for many people, do traditional treatments simply not work?
Yes, so unfortunately, depression is extremely prevalent. 21 million Americans suffer with depression. And the difficult statistic to kind of wrap your brain around is that 30% of patients that are on traditional antidepressants are still suffering with symptoms. So they have inadequate symptom control. And this is compared to ketamine, which has 70+% improvement in symptoms.
Wow.
So it really is a contrast. There are also a lot of disadvantages to traditional antidepressants.
Okay.
The onset is very slow, so it can take several weeks to take hold. Right. There are also a lot of unpleasant side effects with traditional antidepressants, which ketamine does not have.
Tell me the science behind your practice. Why is there the potential for ketamine to be such an effective treatment when, as you mentioned, other treatments have failed or take longer than one might want or need to take effect?
Yeah, so ketamine works in a fundamentally different way compared to traditional antidepressants. So whereas traditional antidepressants work on certain parts of your brain, namely the dopamine and serotonin pathways, ketamine works in a fundamentally different way. So it comes to an old problem, from a new angle, from a new perspective. What it does is it potentiates and increases the amount of glutamate in the brain.
Okay.
And what that does is that it increases the number of connections made in the brain. So literally new pathways are being forged in the brain as a result of ketamine. And what we see with our patients is that this can really help people create new ways of thinking about old problems,
right.
Circumvent maladaptive thinking or behaviors or things that used to trigger them. They're able to work around, and this translates into better functioning, better mood, and it can really help.
So you were an ER physician,
Yes.
So obviously you know what happens when any medication is used inappropriately. How do you manage the safety for your patients?
So at Keta Medical Center, safety is our primary and paramount concern. And I think this is something that distinguishes us. In every one of our centers, we have physician oversight during the treatments. Okay. So every treatment session, you are accompanied by a physician and a nurse to make sure that everything is given safely. At the same time, we like to tailor each individual treatment plan. We understand that people are different and we view them holistically. And so to that end, I will reach out to their primary providers, make sure that their care is coordinated. I want them to be able to reach their treatment goals.
So that it's not just done in a vacuum, which is super important. So if someone out there has been diagnosed with depression and isn't getting the relief that they need with their current medication, what is the first step they should take?
Well, the first thing I want them to know is that there is hope. And ketamine can be that missing link, that sort of X factor in their treatment to help sort of improve their symptoms. The best way to reach us is to either call our office directly or go on our website, schedule the free consultation with me. I do all the consultations. And we are open weekdays, weekends, and evenings as well. So reach out to us. We really want you to be able to have that new lease on life.
Sure. And so with this option. Dr. Malina, thank you so much. Very eye-opening conversation. I appreciate the time.
Thank you for having me.
As if you would like to learn more about Keta Medical Center and Dr. Malina's practice, just scan the QR code on your screen or visit pix11.com and click on the Pix Partners tab.